Okay, this is going to be our blood trace and our walkthrough from the kidney to the spleen. So what we're going to start off with is we're going to start off here with our kidney. You can start at either the left or the right. We'll start here on the left. And venous blood from the kidney is going to be drained by our renal vein here. So you can see a left renal vein, you can see a right renal vein, both drain directly into this midline structure known as the inferior vena cava, or the IVC. If we follow this IVC superiorly, we can follow it up. We can see its base right here. It drains into this heart chamber that is the right atrium. Okay, and so from our right atrium, blood, deoxygenated blood, flows from the right atrium through our tricuspid valve, or our right atrioventricular valve, into our right ventricle. Okay, from our right ventricle, when the ventricles contract, it will eject that blood up and out through our pulmonary semilunar valve here. So remember, it has 3 cusps as well, into our pulmonary trunk, and into left and right pulmonary arteries. So here's a left, and then here's a right on this side as well. You can see how extensive and how branching these are here. When we get to the lungs, it will be exchanged at the capillary level, and we will come back to our left and right pulmonary veins now. So here's left, and here are right pulmonary veins. And now we're on our left side of our heart, or our oxygenated side of our heart. So I'm going to get rid of all of the veins, and I'm going to add in all of our arteries, okay? I'm going to dissect back through this heart to get the view that we want. Okay, and so now that we are on the left side of the heart, we've gone from our left atrium. We'll flow through this valve here, which is our bicuspid, or our mitral, or our left atrioventricular valve, into our left ventricle. So here's our left ventricle here. From here, we flow up and out of our left ventricle through this other valve that has 3 cusps. That is the aortic semilunar valve, okay? From here, we leave the left ventricle through this valve, and we enter into our ascending aorta, then to our aortic arch, and then if I turn this around here and I remove bone to make it a little bit easier to see, we now see our descending thoracic aorta here, okay, from our aortic arch. So here's our descending thoracic aorta. We then transition inferiorly into our descending abdominal aorta, and we'll flip back around, and I'll add the bone back for context. And now we encounter one of the first branches off of our abdominal aorta, which is our celiac trunk. So here's our celiac trunk right here. It has 3 main branches: the left gastric, the common hepatic, and the splenic. And like I said, we're going to our spleen, so we're going to focus here on the splenic artery, which is very tortuous in appearance. It's very twisted. It's very convoluted. It makes its way over from the aorta. So here's our abdominal aorta. Here's our celiac trunk. The splenic artery will leave and travel into the left upper quadrant to supply our spleen with oxygenated blood. Okay? So that is the walkthrough and the blood trace from our kidneys to our spleen.